Hello there. I hope you're well. I'm Hiramani and welcome to Get Set Global. Today we'll talk about malnutrition. Why? Because Assam continues to be one of the bottom five states in Assam when it comes to malnutrition amongst children. As per data, um, infant mortality rate is as high as 48%. 47% women and about 36% children are anemic. And research has proven that poor nutrition in the first 1,000 days of a child's life can lead to stunted growth, which can lead to many diseases and also impaired cognitive ability, reduced school, reduced productivity, and so on. So the figures are unsettling, but not surprising. And the government has launched programs like Poshan Abhiyan program to address the issue. So today's discussion is really to find out where we are at with the program, what's been happening, what needs to happen. And it's my privilege to have an esteemed panel of guests today who have been working in this area for a very long time. So my first guest is Professor Dr. Vinod Kumar Jain. Hello, Mr. Jain.
Yeah, hello, Madam Hiramani.
Thank you so much, sir. Thank you so much for joining. My second
Pleasure.
guest is Dr. Madhulika Jonathan. Hello, ma'am. I think you're mute. You have to unmute.
Hello, good evening. Yes.
Good evening. Lovely to have you. And my third guest is Dr. Tulika Goswami Mohanta. Um, hello, Dr. Tulika. Can you hear? Lovely.
Hello,
Great.
ma'am. Namaste.
Awesome. Namaskar. Yeah, thank you to all of you. So before I start the discussion, would like to do a brief introduction of all my guests. Professor Vinod Kumar Jain, he is the current Vice Chancellor at daisbury University. He has done his PhD from Sussex University, UK. He has over 40 years of experience as an academic and also as an administrator. And prior to his current role, he was the Vice Chancellor at Doon University, Dehradun. Coming to Dr. Madhulika Jonathan, she is the Chief Field Officer at UNICEF Assam. She is a postgraduate medical student from the Christian Medical College in Vellore, and she started her career in 1994. Worked in rural hospitals. She, prior to that, also headed UNICEF Jharkhand and also served as a health specialist in that area. And finally, Dr. Tulika Goswami Mahanta, she is the head of Department Community Medicine at the Assam Medical College and Hospital Dibrugarh. She has over 15 years of experience working as an assistant professor at the Assam Medical Colleges, and she specializes in maternal and reproductive, child health, and nutrition. So, thank you so much to all of you for being here. I'll start with Dr. Jain. So, Dr. Jain, we know that Tezpur University have been involved with the subject, health and nutrition, and we'll talk about it in a moment. But I would like to start by asking, how big is this malnutrition issue in Assam? And I ask that because probably people do know about it, but they know roughly. How much do we need to know based on data?
Yeah. Some of the statistics which you have just provided us.
Right.
In addition to this, I would just like to mention that 46% of women they are anemic, and something close to 35 or 36% of the children they are also anemic. Now that is a cause of serious concern.
So
And
are we talking about rural areas or across Assam we are talking?
yeah, across Assam, but this is mainly confined to the rural folks, because you would agree with me that in case of Assam, the percentage of the people living below poverty line is also quite significant. So it is majority of these women or children who are suffering from malnutrition. Uh, uh, they are the ones belonging to the lower strata of the society, these, socio-economically disadvantaged groups, in tea gardens, in the migrant communities. The 49.9, of course, close to 50% uh, only with the acceptable diet in the age group of 6 to 8 months. So,
Wow.
yeah,
Shocking.
so these are some of the very damning kind of statistics before us. And so the point you have raised about the status of the malnutrition problem in Assam is a very daunting one. I mean, the challenge is very daunting. Because there are many other associated dimensions with regard to the health and well-being of the children and women in Assam. It's not only about the nutritional interventions and the associated dimensions of safe drinking water, the sanitation facility, the hygiene, and all they are interconnected. So the efficacy or the success of any intervention from the government side, however well-intentioned they may be, whether it's the central government or the state governments or organizations like UNICEF, you see the effectiveness of the service delivery at the end of the day uh, depends on a host of factors. And this is where I think coming together of organizations like UNICEF and institutions like Tejpur University and other higher educational institutions, including the medical fraternity. I think coming together and making a effort which sort of synergizes the efforts towards one goal, that is how to bring about tangible improvement in the lives of the women and the children in the state of Assam. And also, one has to bear in mind that after all, the success of this nutritional program is going to ultimately also decide on the fate of the Sustainable Development Goal 3, that is about ensuring the health and well-being of people in the all age groups.
Yeah.
So I think it's very crucial. It's very crucial that the Poshan Abhiyan 2.0 now delivers on the objectives which has set before it.
Yeah. No, thank you so much for setting this in, because some of the numbers you have said are actually shocking. And also, you have said that it's just not about nutrition. It's a more complex issue than that. So we will come to that in a moment. But I like to come to Dr. Madhulika. Let me mute Dr. Yeah. Um, to Dr. Madhulika. So, you know, COVID 19 was not in the plan, but the outbreak has had a major impact to the state's momentum towards achieving sustainable development growth, and also to the Poshan Abhiyan program. Um, and I was just looking at the data, and it does say that number of malnourished children is increasing. I think the Honorable Chief Minister has said that the increase is linked to the socio-economic vulnerabilities. So I want to hear from you where we are at with the program, government's program, and also UNICEF. Where does it fit in? What sort of work you guys are doing? And I'm specifically asking for Assam.
Yes. Yes, no, thank you, Hiramani, for your question. Before I start, let me also take back to what Professor Jain was sharing about the current situation in Assam. And looking at the most recent LFHS 5 data, we realize that children below 5 years who are stunted, That number actually has reduced marginally, though, from about 36% in 2015 to about 35% in 2019. So definitely there has been some improvement. We are not so much better off, but definitely we are on the pathway to moving forward. However, number of the percentage of children who were wasted, that increased to from 17% to about 21% from 2015 to 2019-20, the latest data. And Professor Jain spoke about the children who are anemic, and that increased quite remarkably from 36% to about 68%. And in women, anemia in women, that also increased from 46 to 65%. So while there is this, I would rather say, grim picture that is painted by the data, I do want to congratulate the Department of Social Welfare, because certain safety nets have been created for children, especially in COVID time. And the huge and the tremendous effort of frontline workers during Poshan Ma, distributing Nutri kits, sharing information on infant feeding and healthy diets, tea gardens, the tea gardens in the upper Assam districts, mobile Anganwadis have been set up for intensive messaging and community mobilization in these areas. So when we talk about UNICEF, so UNICEF does not sort of program alone. It doesn't work in a silo. And we work very closely with the government to support the nutrition-related flagships under different departments. And we partner with a range of stakeholders to address the issue of malnutrition. And we do this with a very focused, I would say, like a top-line result around reduction of stunting. And that is something that we do even as a regional office for the whole of South Asia. Some of our very close partners, definitely collaboration with the state government, departments. We work very closely with Professor Jain's team, the academic institution. We work very closely with Dr. Tulika, the medical colleges. We work closely with partners, the foot soldiers, the footprint on the ground, including with tea associations. So we have this very strong collaboration with the management as well as with the, so I would say, the communities on the ground. And very quickly to just share that, as you said, I mean, we are the 21st century, so there's actually a lot of evidence to tell us what works. What really is the need of the hour, especially when we speak around COVID and about COVID, is the importance to ensure coverage, continuity, intensity, and quality for each of these interventions and to shift the needle. It's very critical to ensure that evidence-based nutrition interventions are taken to scale and not just at 60 to 70%, where we are as per NFHS 5, but to take it to 90% to actually get what Lancet speaks about, actually getting the true benefit for children, adolescents, young women. Yeah. And yes, so that is one thing. And then also talking about very specifically, the life cycle approach, which UNICEF speaks about, because you're asking me to also say what UNICEF does. And we have a life cycle approach where we're talking about, as what happens if the baby is born, what happens the first 6 months of life, and then talking about complementary feeding, talking about adolescence and health. Sure. During COVID, very specifically, we have worked very closely with the department to what we call COVID adapted interventions, because face-to-face interactions were very limited. And so we had to really focus on remote supportive supervision, focus on, taking services to the most marginalized, populations. And we also realized that COVID has the potential to reverse many of the gains that were made. And what we are seeing as data of NFHS 5 may have actually also gone a step back. And so that is where we have actually worked with frontline workers to ensure that, specific interventions, home visits, village health nutrition days, telephonic interactions, those have been strengthened. Okay. So I think those are the specific areas for COVID.
Sure. Okay. All right. So, but then you are saying that because of COVID, obviously the focus shifted from the program that the government has launched. And I think the target was to make it malnutrition free by 2022. So we are nowhere anywhere close to that target, are we?
No, no. I mean, there
No.
is a long way to go, but
Mm,
the fact that many strategies are available, there is a lot of learning from the ground. I think we are not without hope.
sure. Okay. Okay. I'll have more questions for you, Dr. Madhulika, but for now, I'm coming to Dr. Tulika. You are at the forefront of this, and you really get to see how people suffer because of malnutrition, and I'm sure you'll have a lot to share. So I really want to start by asking, what are the causes of malnutrition? Because I think people do know it, but how much do they know? From pregnancy to giving birth to breastfeeding to the initial days of a child. What are really the main causes of malnutrition, if you can tell from experts' point of view?
Yes. Madhulika ma'am already told about the indicators. I'll just share some ground experience with you all.
Sure.
So mainly, we from in the northeast, we are amongst the greenery. You can see the availability of food is not a problem, but even accessibility, because these are cheap, easily available. But my feeling is even the knowledge to some extent, but the knowledge translating into practice is the most deficient part, which I feel. So the it is like the food, like we have in greens. So we know the iron rich food is green leafy vegetables, but we are going more towards more of processed food, more of ultra processed food, all these things. And even the front of package labeling, like the juice, we prefer juice than fruits. So we have locally available so many good fruits available to counter malnutrition, especially micronutrient malnutrition like anemia. We have so many citrus fruits available, starting from pomelo, amla. So all these are community fruits. Even the in the Anganwadi center, if there is few fruit tree, but that can tackle the micronutrient malnutrition. But gradually, our children are, even we are going towards like more of processed food, and ignoring those traditional food. Secondly, regarding the macronutrient malnutrition, as madam has told, that stunting, wasting, all these things, again, another problem. Like we have faulty practices. So even the breastfeeding, easily available, organic, free of cost, it gives bonding from between mothers. So many advantages we have, but still the if you see the practice pattern, it is low. So we expect that it should be very high, and across different socioeconomic gradient, everybody should promote breastfeeding. So everybody has, though we have lot of improvement than a few decades ago, but still we have long way to go. Secondly, the complementary feeding at 6 months. Again, we have like the diversity, like giving variety of food, giving energy dense food, the frequency, that knowledge is there, is somewhere there is some gap that I feel. Again, some myth and barriers, like for example, not to give citrus fruits during menstruation, during pregnancy, some restriction of food, even during lactation. So and also you can see in community, you can see the white, like the milk and milk product, which is rich in calcium. Many a times the people, rural community, they sell their own household products like egg, milk, which is available in their household, and they sell it, and they buy biscuits or some chips for their children. So because of
Mhm.
those good packaging, good labeling, and good branding, actually the nutritional behavior is gradually changing, which is, I think, very maybe a bit dangerous situation for the future. So that is why my feeling is we need to promote more of traditional food. We need to promote all those locally available fruits, vegetables, and also we need to promote more of unprocessed food than those ultra processed food.
Okay. Okay. No, thank you for updating with all these answers. But I'm slightly confused here because feels like malnutrition is a problem mostly to do with economic status, people when they don't have enough to buy food. But here you're talking about people going for packaged food and not having the food that they have at home. I'm slightly confused. So is the malnutrition problem not really related to economy, that people don't have money to buy food? Is that not what you're saying? Because it feels like it's a bigger problem than that.
Yes.
Is that what you say? Okay. Okay.
Yes,
All
both
right.
way it is true. Like you can see, one is this acute malnutrition. You can see, like for
Mhm.
example, now the flood affected area, there is some crisis of food, and mainly even in the urbanites, even in the those who can afford also, you can see that because of nutrition behavior, more going more to so not knowing the what should be the energy dense food, what ideal complementary food, when to start, all this knowledge gap is there. And because now chips, suppose chips is available, easily available within 5-10 rupees packet, even biscuits is easily available, so very cheap. And these are ready mixed foods, very easy to prepare also. Like many so instead of giving fish, making curry, making khichdi, which was our traditional food, kheer, etc., so which is time consuming, so we are also maybe going towards those shortcuts. And as and initially my feeling is, if we start giving complementary feeding with some artificial, then children's behavior also changes.
Sure.
So
Yeah.
my feeling is always we need to start with a breastfeeding, then the ideal complementary feeding, which is locally available. And we have so many foods available with a very minimum or low cost. So even from after 1 year, we can give from the family pot. So our traditional food needs to be promoted. That is one thing which we want to focus. We have the traditional, like for example, I just wanted to tell you one item, that is zolpan, we call it, like rice flakes with some yogurt, with some jaggery, which are nutrition dense. But we are how many of our children takes it, and what is the cost? It is not a very costly thing. So
Right.
good nutrition is no, I do not feel that good nutrition is very costly.
Costly.
It is affordable, but we need to have the knowledge. I have
Okay.
seen many people, they have fish in their home, but they are selling that and buying some product from outside, like sweets, snacks, etc., for their children.
Okay, good point, good point. But I'll come to you for severe acute malnutrition because surely I want to know more about that part. But coming to Dr. Jain, so like we said, just touched up when that Daisbury University really gets involved in this subject. And I am aware that you also, Daisbury University runs health and nutrition programs. You bring experts, researchers, really dig deep into the subject. So, how does Daisbury University support state nutritional programs?
Uh, Let me begin by sort of expressing our gratitude to UNICEF that they 2 years back they had established this center at Tejpur University in the Department of Sociology, and this center has the name Nutrition and Community Action Resource Center.
Okay.
Now, uh, ever since its inception, this has you know got this, or the center resource persons, they have got engaged in the with the community of the tea gardens and elsewhere. They have covered some close to 20 districts, and in 4 of these districts actually they have dedicated staff. And that's where I would like to sort of express our gratitude to UNICEF that they are providing the funding to the center to carry out the field visits, to carry out the research, to carry out the analysis, and so on. But one of the USPs, I would say, of Tejpur University is that we can look at the various disciplines which exist, or the academic programs in various disciplines which exist in Tejpur University. So we are in a advantageous position to look at any problem from an interdisciplinary and a transdisciplinary lens. And this is where I think Tejpur University stands out, just because uh, I'm not trying to be sort of boastful about the reputation or the credentials of Tejpur University, but bear with me that Tejpur University does have a reputation,
Of
uh,
course it does.
and uh, and over last 2 years or so, this center uh, has been doing a lot of good work. They are also engaging with the Department of Social Welfare and Department of Health of Government of Assam, and they have been undertaking training programs. And basically, at the moment, they are engaging in the community engagement and the advocacy, the behavioral change which Dr. Tulika Goswami Mahanta talked about. I think it's also very crucial, because you have to look at the, apart from the socioeconomic factors, but you also have to look at the cultural and the social structure of the people of Assam. But one of the difficulties I was told by the center people was, and perhaps Dr. Madhulika Jonathan knows about it, that the accessibility is one of the issues, especially in areas which are riverine areas, in char, they call it in local language, uh, char areas, or the
Okay.
areas where the Muslim
Right.
migrants are
Yes.
settled. So so these are the areas where the challenge is there. But at the moment, the department is undertaking the sensitization programs and training programs, the capacity building programs, in partnership with the Department of, as I said, Social Welfare and the Department of Health, with the full support of UNICEF. And I must really put on record our sense of appreciation to UNICEF Assam. They have been very, very supportive. This wouldn't have been possible without their support. And in fact, not only this particular center in Department of Sociology, they are also supporting a couple of programs, because media also plays a very crucial role. And in the Department of Mass Communication and Journalism, they have
Right.
been supporting a couple of projects. So we are doing our bit as a responsible higher educational institutions to see to it that if we can make some meaningful change in the lives of the people, uh, we would be hugely satisfied.
Great. So is this because there is a budget allocation also? So is this budget really coming from Tejpur University, or how does
Uh,
that work?
See, major funding comes from UNICEF
Right.
for this center. Apart from the logistics and other infrastructural support which the university provides, because university does provide its support to all the academic departments, whether it's the
Right.
sociology. In fact, Tejpur University has Department of Sociology and Department of Social Work.
All
And
right.
given the nature of the academic mandate given to this Department of Social Work, it's in the fitness of the things that UNICEF has actually chosen us as one of their partners in engaging with communities, in
Right.
thinking about behavioral change,
Right.
organizing capacity building programs
Yeah.
for ASHA workers or for Anganwadi workers or Anganwadi supervisors. So we are playing a role, but as has been mentioned a little while ago, because of this COVID, there were setbacks, and but then the center did uh, fine tune and reschedule the field visits. But as of now, as far as I know, my information goes, there are dedicated staff is still working in Jorahat, Goalpara, and Sonitpur district, and one more district,
Right.
and they're also overseeing some other districts.
Okay, okay, that's good to know. So I think if I sum up, it's more like your expertise, use the university expertise as a resource really in this entire program, which is quite amazing. And if yeah, Daisbury University is picked up. I think that says something about the university, so that's great. I'll go to Dr. Tulika and then come to Dr. Madhulika. You just mentioned about severe acute malnutrition, and I think you know this more than me that the numbers are increasing, cases are higher in some of these aspirational districts and also among the tea tribes, as everybody has been mentioning. I am also aware that there are already existing programs in these areas, but do you really see the need to have additional interventions as a top up in these areas? Do you feel that way?
Yes, severe acute malnutrition is another area which is actually reflects the chronic malnutrition, like long-term deprivation of nutrition in children. So it is like as you mentioned initially that 1,000 day. Even I feel that more than 1,000 days, even the adolescent nutrition also linked. We have if adolescent malnutritionized, then there is three generational effect of malnutrition. Then again, long-term deprivation leads to stunting, that means low height for age, and ultimately even because of lot of chronic infections, like it is not only nutrition deprivation, also the infection and infestations. Like you can see, like now the corona is one, but before that
Okay.
the all the statistics
Okay,
like NFHS was
she
done
was okay.
before
All
the
right.
COVID
I think I'll
pandemic.
go to okay. Can you hear us now, Dr. Tulika? Yeah.
Yes, 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 yes. Can you hear me?
Yes, yeah, yeah. We can. We can. Yeah, because we're talking about
Uh-uh.
infections and all
So
of that.
yes, yes, infection and infestation, another one. We have
Mm.
very high worm load, especially if you see the garden community, tea garden areas, because of the humid soil and some practices like water sanitation and hygiene. These are some other areas which also affect infection and infestation. Low living conditions like housing conditions, etc. So the many factors, like many environmental factors, socioeconomic factor also influences malnutrition picture. So if there is infection and infestation like chronic respiratory infections, diarrheal diseases or worm infestation, that also work as a nutrition leak.
Right.
So there is because infection leads to, it's a vicious cycle type. Infection leads to malnutrition and malnutrition leads to infection. Ultimately there will be chronic malnutrition, which is presented as there is three type of things, like mainly we call it as a most important indicator is severe acute malnutrition, which we categorize in our as a red category. Then we have moderate acute malnutrition. So this
Yes.
nutrition monitoring is also important at the field level, so that we can identify this malnutrition problem early. We can and also we need to do work for problem, local solution, like as madam has told about ICDS, social ICDS system. So through that system, the monitoring of we have the MCP cards, mother child protection card, MCP card, and also height monitoring devices are available in all Angan, means at the village level. Anganwadi centers, it is there. So we celebrate at the village level Village Health Nutrition Day, and during that monitoring of all the children below 6 years is essential, so that we can identify this malnutrition early, and then we can do timely referral. And also, like as we told about the community participation for different, like kitchen garden promotion, good cooking demonstration or cooking practice promotion, etc., needs to be done, so that if we can make our community empowered and participate in our program, I feel this severe acute malnutrition gradually we can tackle, but it will definitely take time and involvement of all department. Like convergence is another very important point which needs to be focused.
Right. So you are saying that some of these programs are already there. It's just it needs to be accelerated and the community needs to come together as well. Okay.
Yes.
I think I'll have
Yes,
more to
we have
talk
so
about
many
that.
good programs.
Yeah,
But
absolutely. Yeah, absolutely.
implementation, we need to
Yeah,
strengthen the implementation.
yeah,
Yes, yes.
exactly. I think the same question I
So
would ask.
UNICEF is doing
Sure. Yeah.
uh,
So, Dr. Madhulika, I think I'll have similar question for you as well about the best practices and innovations that can be implemented in these, vulnerable areas, and that can be adopted by the district administrations as well. So, what can be some of those best practices?
So thank you for this question, because we've been working closely with the departments and district administrations, and we already have few examples within our state, because we can learn from other states. But what is Assam specific? Because what Dr. Tulika and Professor Jain spoke about is the vulnerable populations, the T tribe communities. We are also multi-hazard prone. We have the perennial floods, and we have the soil areas. And what is relevant there, we need to learn in Assam. So some of the good practices that have really come up, one is our sort of multi-sectoral collaborative work in the 205 tea gardens in Upper Assam. And we worked there 3 years. And what we have learned there is now very scalable. The work with communities, the work with the tea association, I would say even the tea management, the creche workers, that is very scalable, about maybe 1,000 tea gardens of the state. And this is something that the Department of Tea Tribes Welfare is looking at with the other departments to see how they can scale that up. Also with district administrations, because there have been areas which have been very district specific. In Jorhat, we worked to strengthen promotion of complementary feeding. In Dibrugarh, we worked with care for children with severe acute malnutrition, especially with COVID adaptation. In Gwalpara, in Lower Assam, also worked with an early childhood development model. In 4 districts, we've also started working through the department on a responsive parenting model, which really builds capacities of parents and caregivers to provide, the what we call nurturing care, stimulation, along with appropriate nutrition. And these have been very important because, what I always believe, nutrition sensitive, nutrition specific, the interdependence of results, the interdependence of departments, I think that cannot be ignored for nutrition. And you say that, the way you were saying here, Ramani, that this is a huge agenda and we cannot do it alone. Not just one department, not just one academia, not just one UNICEF, not just medical college. And we need to come together as a team because of the strengths that we have and the strengths that we bring to the table. With the health department, been working very closely to strengthen maternal nutrition interventions, and also bringing together the power of women, the empowerment that the Assam State Rural Livelihood Mission brings about, ensuring women's participation, ensuring that they know what they can eat, what they can give to their children, the whole concept of nutrition diversity, what is on my plate, what is on my child's plate. I think that those are very critical areas where we need to work, and also work, where is the money to buy that food, because in COVID everybody struggled with livelihood as well. And so working closely with departments, I would say non-traditional nutrition departments like the gram panchayat, the rural development, and see how can we bring the nutrition agenda to the gram panchayat development plan, and have gram panchayats plan for their children. Can that ownership come from the gram panchayats, rather than always expecting that we connect, and that it will be something that we reach out to, rather than they also strategize and contextualize for them. I think these are very important learnings that we have, from at least some districts, maybe 100 gram panchayats, and that is something that is really scalable. If you look at Poshan Abhiyan, and I'll just close with that, the Poshan Ma, September is the Poshan Ma. And this is also a very important platform to say, that nutrition is everybody's business. It is the business of, hand hygiene, of PHED, the water department. If there's no water and there's no hand washing, we know that 60% points of malnutrition come from water sanitation. And when we talk about health, when we talk about multiple departments and sectors, we can see that there are sustainable results which can come out of flagships. It can come out of Jal Jeevan Mission, it can come from the Swachh Bharat Mission, and these are contributions. These are contributions beyond the just what is on the plate and what is the health of the child, and they are very, very key, I would say, determinants that will ensure that Assam's children are on the right track. I'll stop
Yeah.
there.
No, I couldn't agree more to what you have said, that it can't work in isolation.
Yeah.
It has to be that partnership. And when you talked about women empowerment, makes me also think that I think this is also to do with the fact that, we still have got this idea that, the boy of the family needs to be fed well, go to the school, get educated. Maybe that also adds to the problem. But did you want
If
to
I can
add
come
to
in
that?
very, if I can come in, I'm sorry to interrupt you, but if I can come in very quickly, I say that the very high rates of child marriage for
Exactly.
Assam is also a
Exactly.
big contributor, because it is an intergenerational malnutrition. It's not just intergenerational, sort of a negative balance that we are creating. A very young teenage mother is having a very low birth weight baby who is already,
Yeah.
starting on a negative, I
Yeah.
would say, negative balance, not only just a calorie balance, but a negative balance. And I think that bringing together just not the nutrition agenda doesn't stand alone, but stands along with the development of, the development agenda. And then it needs to really come together, to empower women and families and communities. We know that women who are more educated do better both in health of themselves and their children,
Children.
and that
Exactly.
contributes again to reduction of malnutrition. So yes, there is a lot of space to work, and there are many things that we need to bring together and work collaboratively.
Fantastic. No, thank you for adding that. So, Dr. Jain, just an extension of that question, really. It just feels like to me that creating awareness is really is key. Is a bigger part of the solution process. So, keeping that in mind, and the kind of contributions that Tezpur University is having in the field, what do you think should be or can be the role of academic institutions in advancing public and health interventions? What do you think? What should be the role?
Uh, in fact, this particular role is being sort of discharged by the institutions. Not only my university, across the country, most of the institutions are undertaking these sensitization campaigns or the awareness campaigns about all sorts of issues. Some of the issues Dr. Madhulika did mention about the hygiene, about the sanitation, about the pollution issues. Um, so the students, and in fact the youngsters in any institution, by and large, they are the sensitive lot. They are very, very socially sensitive lot. So you have this huge workforce already available to you as volunteers. And in fact, some of our academic programs, we have factored in these extension activities or outreach activities, and we have assigned credits to them. So we encourage the students to be part of this larger noble mission, and do all they can do to improve the lot in the society. So it is not only confined to the social department of social work or department of sociology, even the department of environmental sciences, for example, and department of languages. We do have a department of cultural studies. All the departments, they do have a compulsory outreach program or an extension activities program. And we do engage with the communities wherever it is possible for us to do so. But I would, in case of Tejpur University and this kind of partnership which we have with UNICEF and with the departments, of course, with the government departments, it's not institutionalized in the sense that we haven't been identified as a nodal technical center. But
Okay.
ideally, if the Department of Social Welfare, Government of Assam, or Department of Health, if they could identify a couple of institutions, I'm not necessarily zeroing on, Tezpur University. In addition to Tezpur University, that there'll be a couple of, nodal technical institutions or nodal, whatever name you want to give, so that they could be roped in to catalyze in some ways this awareness about the various dimensions which Dr. Madhulika has talked about. Basically, many times it's about the behavioral change.
Right.
Yeah. So that's where the students can play, a huge role, both male and female students, and especially the female students.
Right.
So I do see a very sort of constructive role for the educational institutions in this huge effort under the Potion 2.0 Abhiyan.
Right. Okay. No, thanks for saying that. So, my then, when you were saying all of this, my mind goes, what does ministries, government do when they need data, when they need resources, and like you said, students, they can be great, resources. So is it something? Do you think the work has been already going on that ministries show more? I mean, encouragement, or they really want to come and partnership, have that partnership with academic institutions. Are there more work going on, or you're not quite sure if there is more? Because it sounds like a brilliant idea.
Yeah, in some cases they do partner with the academic institutions. For example, one area where I can see a possible engagement with the government is in the data collection, as you just mentioned. Can we track the individual child or a lady's, health status on a smartphone, for example? And if the students are provided this kind of equipment, which is not very costly. So, the tracking and the monitoring, the tracking of an individual, whether a small child or a, or women, that can be sort of, huge data can be generated.
Right.
In addition to what the government is already doing. I'm not saying that the government doesn't have its staff doing exactly the same. But my point is that if we can have this additional workforce which can sort of supplement or augment your efforts by providing you this data. And by the way, see, one of the advantages with these students is, and especially these research students or the postgraduate students, is that they would like to look at the data with a different perspective. They would like to infer some useful connect with various factors and the improvement or the lack of the success or whatever uh, in the interventions which the government wants. So
Yeah.
as far as the research part is concerned, data collection, analysis, and possibly the findings which have some policy implications. So I think in this respect, that the academic institutions would play a very
Yeah.
important role.
Yeah. No, thanks for bringing this up. I see this as a very, very positive point. I mean, it feels like a resource issue in a lot of times, but you have, like you said, students, and they have got a different perspective of looking at things. So this is very encouraging, actually, if we work on those lines. But coming to Dr. Tulika, I Okay, I think it's an extension of the same question, really. And it's more to do with, again, creating awareness. If I can unmute you, let me first try and do that. Yeah. uh, So, when it comes to the vulnerable communities where attention is required, how can we increase awareness? Because it feels like there are existing programs, it feels like there is help on offer for those who need them, I can't see you very well. Yeah. Um, uh, there is help, but then I think we need to create more awareness so these people know what to do, where to go, where they can find help. How, what did you say? How can we create those kind of awareness? Can you hear
Okay.
me? Okay.
Okay, for vulnerable community, we need to have some special focus program for the to cover them. I also feel that there is a big role to play by ICDS sector. We need to brand them, we need to promote them, and also second thing which we need to like, we need to promote all this. We need to use all the different media mix, like in different areas we can use different type of media with good community participation. That is my feeling. Nutrition behavior needs to be like some small awareness campaign, starting from small local campaign, interpersonal communication, training or capacity building of our frontline workers, convergence on also branding of ICDS, so that there is better utilization, because the iron folic acid supplementation is there, freely supplied to different vulnerable groups, but the compliance is again gap. Like that is why 50% only consumes the iron folic acid tablet. So we need to improve the compliance. So for that, again, compliance monitoring, making the people aware is important. And also, like, my feeling is a different media mix, different media for different community need to be utilized. Then only we can expect that there will be very good, we can improve the situation of malnutrition in our community.
Okay, cool. Dr. Matulika, what do you say? Because what just Dr. Tulika said, it feels like, do you know, there are efforts probably, and I did hear Dr. Honorable Chief Minister saying there is no shortage of food in the country, but it's heartbreaking to see children dying from not getting enough food. I just heard from Dr. Tulika that it's just creating more awareness, you know, where folic acid and iron, it's all available, but people are not taking those, you know, I think advantages. So where do you think is the problem? Is this problem bigger than what it looks and feels like on the surface?
The problem, as Dr. Tuleka also mentioned, the problem is multidimensional. So it is not just as in my previous response, I had also talked about teenage pregnancies. I talked about a very a whole life cycle which creates this kind of a deprivation and finally creates malnutrition and stunting and wasting. So when we're looking at, we're looking at the problem, we're looking at not just, food security, we're also looking at nutrition security. One is the availability of food, and then what is the quality of that food? How much of each component which is supposed to be on the plate is there? How much, protein is a child getting? Is it all rice? Is it all mard? And is it all bhat? Is it all rice based? Is it all carbohydrate? Because finally the child needs protein growing up as well. And so where is that balance? So I think the balance is very critical, the balance between the vegetables and fruits all locally available, and also talking about the methods of cooking. So one thing that our nutrition team has done also is talk about local recipes. What is it that when you cook food, you can actually retain more nutrients and nutrition within that food, rather than cook it in a method which actually most of the nutrition is actually lost by the time it reaches the child's plate. So I think it's looking at local food. It's also looking at local recipes which are context specific, which are easy to cook. In the rainy season, we know there is, and in the flood season, we know there's not that much firewood for a woman to make different kinds of food. So we may train workers and we may train mothers, but finally we have to be very pragmatic about what is possible and then what is best and how can we meet the nutrition requirements of children. One
So
thing
is
in
there any,
COVID, which workers all sorry,
no, I was just going to
yes,
say,
please.
is there anything we can learn from states like Kerala? Because, feels like Kerala doesn't have malnutrition issues. So what they are doing right, because I'm more and more getting to the point that it's not about shortage of food. It's like you said, multidimensional. What do you learn from states like Kerala?
See, for Kerala, starting with their, their maternal health, which is, a healthy mother has a healthy baby. So their maternal health indicators are excellent. And then going from there, also looking at the, support systems, the schemes, the implementation of schemes, because it is not that we do not have schemes. It is not that the government is not investing in ICDS. It is how we are able to reach the most vulnerable and what is the quality of that. So when we talk about the quality of it, the intensity of it, the coverage, that is very important. Every scheme, every, be it ICDS, be it other schemes. We have other schemes like the Pradhan Mantri Matri Vandana Yojana, which is for nutrition for a pregnant mother. And so when we're looking at these schemes, the implementation of these schemes, the quality with which these schemes are given, is it reaching the mother very, very late? So she's actually crossed all her pregnancy time and she's getting the money at a point where she is ready to deliver, and so she still has a malnourished baby. She's still going to give birth to a low birth weight baby. So I think those very finer points will change the needle. That will shift the needle, because it is not that investments are not there. It is that they need to be of they need to reach people at the right time. They should be of higher quality. They should be, there should be a continuity in the intervention. It's not a one-time thing that we give one-time food or a one-time incentive or a one-time, intervention. It has to be continuous.
All
And I
right.
think that will be very critical for change.
All right, great. So you're saying on time and consistency. So those 2 points.
Yes.
Dr. Jen, we have been obviously talking so much about the research side and the data side, and all that is so crucial to get to know what's going on. So also people who are we can be accountable, about the outcomes. But there is also the other side, people who are working on ground, who are making things happen. Do you think that there needs to be better synergy, better integration between the two to see the results we all want to see? Do you feel that way?
Yeah, of course. I mean, it cannot be overemphasized, actually. The efforts of all, whether it's government, whether it's the district administration, whether it is the NGOs, or whether it's the self-help groups, the academic institutions, see, their efforts have to synergize. This cannot be in isolation, that one institution or one entity is doing something. See, they all have to sort of uh, be part of the complete package, so to say. So unless each one of them is assigned kind of responsibility, that this is what you have to do, whether it is advocacy or community engagement, this is the research part you have to do, research analysis and perhaps policy recommendations based on whatever research you have done, or the compliance part, which Dr. Goswami did mention, that, or maybe Dr. Madhulika mentioned about the compliance part, whether the child is actually being given that tablet, or whether the ladies are taking their nutrient supplements which are prescribed for them. So all that can be done effectively if the volunteers, or you know the NGOs, the persons on the ground, actually they monitor these micro details.
All
Whether
right.
if you leave it to the individual, it's not going to happen. And you did mention about Kerala. One of the reasons why perhaps in Kerala this problem is not there is it has the highest literacy rate. So the women, they are
Exactly.
very educated there.
Exactly.
So the point is that this is it's a complex issue. It's a complex issue. Everybody has to put in their effort so that each one of them sort of fits in the big picture.
Yes, yeah, so well said, so well said. Because of time, also obviously we'll have to wrap up. But I think I just want to get a final answer from both of you. More, I think, for actually Dr. Madhulika, that working in this area for so long, working with all the administrators and ministries, what has been the biggest frustration in wanting to make changes for better? And what is one solution you really think can work? I know it's a difficult one to say, but if you had to pick up, what would you? I think both can respond to that. One
Uh,
frustration, one solution.
I think what the biggest, I would say, frustration right now is the uncertainty that COVID brought, because
Sure.
things were sort of settling in, and children were already at the Anganwadi centers, and we were looking at how to strengthen the point of care, and COVID changed all that. So we've really had to rethink the strategies with the government, that how can we continue to reach children. I think the solution really is to be adaptable. We have to be adaptable. We have to continue to be able to identify the children, because sometimes that is an issue. Identify the children who are malnourished children, and prevent the children who are on the borderline from going tipping over, so to say. So I think that is a very critical thing. And I think awareness can never be undermined. So awareness and linking them to government schemes, because government really is the greatest, duty bearer of the whole piece. How we can link every community to the government, I think that will be also a big solution.
Fantastic. Dr. Jen, do you have anything to add?
I'll just say one thing, that any penny spent uh, in this health and nutritional program is going to actually yield many more times economic return. So I think
Fan-
it's going to be it's good. This point has to be hammered home to the central government as well as to the state government. In
Fantastic.
fact, yeah, that if you spend, I was reading somewhere that if you spend in India, if you invest $1, is going to give you economic return of some $35 to $38. Now that's a mind-boggling economic return, and this has to be told to all the lawmakers in this country, the people who actually implement the laws in this country. So I think see, one of the things which Dr. Madhulika did mention, I would just supplement or
Sure.
add to what she has said, is
Hmm.
that money is important for these programs. So let us all work to uh, impress upon the state government as well as the central government that
Yeah.
the money, the allocation in the budget for these programs uh, must not be reduced or if not enhanced.
Sure.
So this is something which I would strongly request all these uh, you know stakeholders and the well-meaning people,
Right.
the
Okay.
well-wishers of Assam, that let us increase the allocation a bit so that for want of funds, the 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 service delivery is not affected.
Right. Okay. So I think the final message was, any investment in health and nutrition is a good investment, which will help in sustainable economic growth for the state, for the country. On that note, can I just say thank you so much for being here, and thank you for all your inputs, insights. I really do appreciate your time as well. So yeah, thank you. Best wishes for all the
Thank you
work
very
you are
much.
doing. Yeah, so keep well.
Thank you.
Goodbye. And yeah, so thank
Okay.
you to everybody who is watching as well, to the Sentinel. And yeah, goodbye for now. All right.